So here we're looking at a plastic torso model. Quite a few structures have been removed. You can see parts of the lungs have been taken away. So we can see the heart sitting in the middle there of the mediastinum. We can see the right and left auricles. We can see the aorta and then the pulmonary trunk here at the front. We can see the superior vena cava coming down to drain blood into the right atrium. We can see the two brachiocephalic veins that come together to form that superior vena cava. And superior to them, we can see coming down from the head the internal jugular vein. So this would be a right internal jugular and a left internal jugular vein. Now the internal jugular veins sit deep to the sternocleidomastoid muscle. So if you're looking at a specimen or model that has a sternocleidomastoid muscle on it, you're probably not going to see much of the internal jugular veins. So here's one where that's the case. So here's a head and neck model. Sorry, I'll just superimpose that there on the model we're looking at earlier. Here's the sternocleidomastoid. So this vein here, which is external to the sternocleidomastoid, will be the external jugular vein. So if you can see sternocleidomastoid and there's a vein on the outside of it, it's the external jugular vein. If there's a deep vein in there that's deep to the sternocleidomastoid, that will be the internal jugular, and it's much, much bigger in diameter. It's a very large vein, the internal jugular. So with the external jugular, if someone is straining to lift or sing or yell or something, you will often see that vein on the outside of their neck, under their skin. So that will be the external jugular. This one bigger, but deep to the sternocleidomastoid. Okay, now on this model again, we can see the aorta here. We can see the brachiocephalic trunk, both here and here. And then we can see that it splits into a right common carotid and a right subclavian. And we can see that there's a left common carotid here running up the neck, and then a left subclavian which runs out to the left upper limb. Now also on this model, it would be a good idea probably to zoom in a bit and have a closer look. If we look at the neck here, we can see that we have this left common carotid artery running up the neck, and when it gets just to about the level of the mandible, which would be about here, it splits into an anterior one and a posterior one. The anterior is the external carotid artery, and the posterior one is the internal carotid. Now the external supplies the face and scalp, and some structures of the neck, and the internal goes straight to the brain, goes through the carotid canal into the skull and supplies the brain. So that would be external carotid artery here, internal carotid artery just behind it. And of course this vein travelling with them is the internal jugular. Now if we then come back out a little bit and have a look more inferiorly on this model, now we're in the abdomen, and we can see here we have an inferior vena cava and the aorta. Now down here in the abdominal cavity, the aorta splits into two branches. So that's the end of the aorta right there, and it splits into the common iliac arteries. So here we have a left common iliac artery, and here we have a right common iliac artery. Now they're only fairly short because they themselves then split not long after they arise. So if we tilt the specimen this way, we can see that here we have the left common iliac artery, but it splits into an external and internal iliac artery. So the internal iliac artery is staying within the pelvis, so it's supplying these deep structures of the pelvis. So there's the internal iliac artery there. The external carries on travelling with psoas major, travelling along psoas major there, and actually enters the lower limb. It goes under the inguinal ligament into the femoral triangle and becomes the femoral artery.